This is not a free market. You don't get health care because you want it. You don't wake up in the morning and say, gee, I'd love to go down to the emergency room today. You enter that market unwillingly. You know nothing about the products that you're being asked to buy in the market. You have no choice of those products. Hi, I'm Steve Brill. I've got the cover story this week in Time magazine looking at the healthcare debate from a very different perspective. Everybody focuses on who should pay for the exorbitant cost of healthcare. And what I decided to do was ask the more fundamental question, which is, why does healthcare cost so much? I looked behind 8 bills and traced the bills all the way back to who's getting what money, who's making what profits, and the results are really surprising. One of the things I found that everybody in the healthcare industry knows about, but that nobody else knows about, is something called the Charge Master. And the Charge Master is an internal list in each hospital of the thousands of different items that they charge for. And nobody could explain it to me. And indeed, it would be hard to explain. For example, why would you charge $77 for a box of gauze pads that you can buy for $1 at the local drugstore? Why would you charge thousands of dollars for a CAT scan that really doesn't cost you anything? It's emblematic, if you will, of the irrationality of the entire healthcare system, because no one can explain the costs, no one even tries to explain the costs, and the only people who are guaranteed surefire to be asked to pay the Charge Master prices are the poorest people who don't have health insurance. The real profit makers are the way hospitals mark up the very expensive drugs that you get. If you have cancer, if you have pneumonia, they're making thousands of dollars on these drugs, and the drug companies in turn are making still more thousands of dollars. Obamacare does very little to solve any of these problems, which is probably why it got through Congress. It doesn't do anything to control the prices of prescription drugs or medical devices, such as a CAT scan. In fact, if anything, it will increase the profits of all the players in the market by making sure that more people have insurance, and therefore more people are in the marketplace with the funds from insurance companies to buy all these products. Insurance companies are not really the problem. They're run pretty terribly. It's basically sort of a ho-hum business where they process claims. A lot of us think they process claims unfairly or inconsistently, but they are increasingly at the mercy of hospitals which are consolidating, buying up doctors' practices. We should tax profits on so-called nonprofit hospitals and put that money back into the system. We should control the prices of prescription drugs, because if I have a monopoly on a cancer wonder drug, and I can charge anything I want for it, that's obviously not a free market, and it's going to lead to the kinds of abuses that you see in this article once you follow the money.